Hi, I'm Casey. I'll be performing an assessment on you today.
Okay.
We'll be working head to toe. If at any time you have any questions or you want me to explain something better, you just stop and let me know, okay?
Will do.
First off, can you tell me your name and your birthday?
Carly Jordan, 10-104.
Okay? And can you tell me where are you at right now?
I'm in Seagrove, North Carolina.
Okay? And what year is it?
2022.
And who's the president right now?
Joe Biden.
And what brings you here today?
Just for a check.
Thank you. Okay, good deal. All right, we're gonna start off. I'm gonna look at your face, okay? As we've been talking, I've been assessing the affect of your face, making sure your speech is clear, which it is, that you're showing normal emotion, which you are, making sure your eyes are following with the conversation, you don't seem distracted or anything like that. Looking at your appearance, you seem very well kept, very well groomed, which is a good thing. And I'm just assessing the symmetry of your face and your body, okay? You're making sure everything is in line bilaterally, okay? I'm just gonna palpate your face and make sure I don't feel any lymph nodes and check your pulses, okay? If at any time anything hurts, you stop and you let me know, okay? Stare straight forward for me. Okay, no lymph node enlargement. I'm gonna check your temporal pulses. Okay, good. Run pulses one at a time. You don't have to lean, that's fine. Okay, we're gonna palpate your trachea, make sure it's midline, which it is, and we're palpating, make sure we don't feel an enlarged thyroid, which I don't, okay? All right, at this time, we're gonna assess your vision. Okay, stare straight forward for me. Okay, good. We're making sure your pupils are equal, round, and they react to light and accommodation, okay? I'm going to put my hands along the sides. I want you to tell me when you see my fingers.
Okay. Yeah.
Okay?
Yeah. Yeah. Yeah.
Okay, good, good, good. All right, I want you to follow my finger, okay? Just stare straight at the finger. Follow my finger into your nose, okay? Good, good. Your pupils do accommodate correctly, okay? I'm going to hand you this strip right here. There's some letters on it. I want you to hold it out straight in front of you. I want you to cover your, yes, that. Read the letters at the top for me.
A, G, F, D, E, I, L, O, Q, R, M, S, P, L, J, U, K.
Okay, read the bottom line for me.
S, P, L, J, U, K.
Okay, switch hands, please.
A, G, F, P, E, I, L, O, Q, R, M, S, P, L, J, U, K.
Good, thank you. Bottom line.
S, P, L, J, U, K.
Okay, thank you. Okay. All right, at this point, we're gonna check your hearing, okay? So before I do that, I'm gonna just look in each ear, make sure I don't see anything, a lot of wax build up or anything in the ear canal. Okay, good. Good. Okay, now we're gonna do something called the whisper test. I'm gonna stand behind you, I'm gonna whisper 3 words in each ear. I want you to repeat those words back to me, okay?
Okay. Cat, dog, shrimp.
Rooster in house.
Rooster, hen, house.
Good, 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 good. All right. All right. All right. If you could look up for me, I'm going to look at your nostrils, okay? Good. Feel your sinuses. You let me know if you feel any pressure, okay? Anything? Okay. I'm going to give you this. I want you to smell it and tell me what it smells like.
It smells like vanilla or just something sweet.
Good, good. Okay. All right. At this point, we are going to move on to your chest, okay? So I'm going to listen to your heart. Now we're gonna listen to your lungs, okay? Okay, listen right here. Okay, good. All right, now at this point, I'm going to listen to my lungs. When you feel me place my stethoscope, just take some deep breaths, okay? We're going to listen in several places, all right? Front and back. I'm going to come around to the back. Now, if you could turn this way, and then just lengthen for me slightly. Thank you. Okay. You can stay leaning forward for me. I'm just going to percuss your back, okay?
Okay.
We're just checking for any dullness over your lungs, okay? All right. We're going to feel, I want to feel for vibration in your lungs. So I want you, and I'm going to listen. So I want you to repeat a few words after me, okay?
Okay.
All right. House, monkey, dog.
House, monkey, dog.
Okay, good. All right. You can turn back this way. All right. At this point, I'm going to percuss the front of your lungs, okay? Okay, good. Everything sounds good. Okay. At this point, I'm going to have you come and lay down on this bed for us, please. Okay, at this point, I'm going to check your abdominal area, okay? If are you okay with me pulling your shirt up? All right, so I'm just looking at your abdomen and making sure everything looks good. So I don't see any obvious deformities or any scratches, bumps, lumps, bruises, anything like that, okay? Same as I've done for the rest of your body, all right? I'm going to listen to your abdomen in 4 quadrants, okay? Just making sure we hear normal stomach sounds. Okay, everything sounds good. All right, at this point, I'm going to percuss your abdomen, okay? Same thing as we did for the lungs. Just checking for any dullness or anything like that. Okay, everything sounds good. All right, I'm going to palpate now. Just with light palpation. If anything hurts or feels tender to you, you let me know, okay?
Okay.
Checking to watch if I see any obvious rebound tenderness or guarding, okay, which you don't have any. All right, now I'm going to use a little bit deeper palpation, okay? We're going to check out your liver and your spleen and everything, all your organs. If anything hurts, then you let me know, okay? Alright, I'm going to palpate in the back for your kidneys, okay? Still okay?
Yep.
Alright, everything feels good, no obvious kidney or liver or spleen enlargement, okay? Alright, now while I have you sitting here, I'm going to look at your hair so I can see it obvious. It's going to rub through, I want to make sure I don't feel any bumps, lumps, bruises, anything like that. There's normal hair distribution and your hair appears like it is well washed, okay? Alright, good. You can come sit back in your chair for me. Alright, can I see your arms? Flip them over. We're going to check your radial pulses, okay? Just making sure you have good blood flow to your hands, which you do. Give me a little look. You have artificial nails on, but we would be looking at your nails and making sure they are smooth, well kept, that they're clean, that there are no obvious like brittle nails or any like ridges or anything like that. We'll check cap refill in your fingertips. Good cap refill. Check it on both hands. Good. And we're looking at your arms, making sure we see your skin is smooth. We don't see any obvious lumps, bumps, bruises, anything like that. Okay? We're going to do the same thing with your legs now. If you can stretch your legs out, checking down your legs, making sure they're equal bilaterally. No lumps, bumps, bruises, or obvious deformities. We're going to look at your toenails, make sure they look good. Check cap refill in your feet. We're going to palpate your pulses here. Your feet. Okay, good. Alright, now at this point we're going to check your musculoskeletal system, okay? Let me look at my card real quick first, make sure we're not missing anything. Alright. You could raise your arms up for me, straight out in front of you. Push my hands up. Okay, now push my hands down. Wiggle your fingers. Alright, put your arms down by your side. We're going to test your flexion and extension. So if you could extend your arms out, flex them in. Good. Arms down by your side. We're going to test your abduction and adduction. So one arm at a time. If you could raise your arm up, and if you could lower it back down. Same with the other arm. Good, good. If you could lift your feet out for me. Alright. Push down on my hands like you're pushing on a gas pedal. Alright, now pull my hands towards you. With just your feet. There you go, good. Okay. Now if you can stretch both your legs out, I want you to take one foot and run it from your ankle to your knee. Good. Same with the other one. Wiggle your toes. We're going to do adduction, abduction with your hips as well, okay? So if you could take this leg and bring it out to the side and then bring it back in. Good. Bring it back in. Same with this one. Good. Okay. Make sure. All right. We're going to take a few steps and make sure that you're able to walk well, okay? If you stand with me, take a few steps this way. You can turn around. Okay. I'm going to have you stand right here. All right, we're going to check your spine, make sure that that it feels like it's in a normal place in your back, no odd curvature or anything like that, okay? You could bend over for me and touch your toes. Okay, normal curvature of the spine. At this point, we're going to do the Romberg test, okay? If you will back up to your chair, we're going to start here. This is just testing your balance. So you're going to walk one foot in front of the other, and I'm going to hold my hand right here, okay? Ready? Go. Good. Good balance. Okay, you can return your foot in your chair. Sure. Okay, you can sit right down. One last thing, we're going to check and make sure the muscles in your face are working correctly. So if you could shake your head side to side. Up and down. Shrug your shoulders for me. Smile real big. At this point, I'm looking at your teeth, making sure that I don't see any obvious missing teeth, because we want to note that, okay? Make sure I don't see any cavities. You don't wear false teeth, correct? No, okay, they look good. All right. Raise your eyebrows up and down. Closing up in your eyes. Puff your cheeks out for me. All right. Thank you so much.